Hi, I'm Dr. Clay Mecklin. I'm a urologist in Central Missouri. I subspecialize in male reconstructive surgery and prosthetic surgery. I'd like to take a few minutes to talk about some of the major game changers in urology and men's health. So here's the list. You have the minimally invasive penile implant for erectile dysfunction. You have the artificial urinary sphincter for severe urinary incontinence. You have Xiaflex, which is an office procedure for the treatment of penile curvature and Peyronie's disease. Then UroLift, minimally invasive treatment for BPH and difficulty urinating secondary to an enlarged prostate. So the first thing I'd like to discuss is the penile implant through a minimally invasive approach. Now the penile implant is by no means new. It's been around a long time. It's a great treatment for severe erectile dysfunction. And there are several different approaches out there to put the implant in. And the infrapubic approach is not new. Basically, that's a small incision above the base of the penis in an effort to try and stay out of the scrotum and avoid swelling and postoperative pain. Now, what is new is the ability to implant the three-piece inflatable prosthesis through a very small incision. And there are also some other techniques that go along with that to make the operation faster and smoother. The faster the operation is, the less chance there is for infection, and the faster the recovery. And this approach was popularized by Dr. Paul Perito in Miami, and I've adopted the same approach for my first-time implants that don't require extensive reconstructive surgery. The next thing I'd like to discuss is the artificial urinary sphincter. Now, sometimes after radical pelvic surgery or other even minimally invasive surgeries, that sphincter can be damaged, and that sphincter controls urination, okay? And when that happens, you've got a major problem, okay? Men develop severe leakage and loss of urinary control. They go from wearing multiple pads to even diapers. Some people even wear a clamp across the penis, but you can imagine how painful that is because their incontinence is so bad, and this can just devastate somebody's life. They don't go out in public, they don't do their normal social activities, and you'd be surprised how mmany men have been dealing with this for 5. And there's a great treatment out there, and that's this artificial urinary sphincter. And I've seen such a dramatic effect and change in people's lives by doing this operation. I mean, they're back to their normal activity, they're out of diapers, not wearing pads, maybe one pad with severe activity, but I mean, it's a dramatic improvement of the quality of life. And it's definitely a major game changer. UroLift. And UroLift is a minimally invasive procedure that helps relieve blockage of the urinary channel from the prostate. So as a man grows, his prostate enlarges and compresses that tube. It would be like if you were trying to blow through a straw and somebody pinched the sides. It would be harder to force the air through. Well, that's exactly what the prostate's doing. Okay, it's enlarging, it's compressing that tube, and the bladder has to work harder to force the urine out, and that can result in very bothersome urinary symptoms. Now, the traditional therapies for this include medications, which can have some side effects, and you need to take the medications basically for the rest of your life. There are some other surgical procedures that are available. Okay, the side effects of those procedures can include bleeding, infection, scar tissue, need for further procedures, and many of them require you to decrease your activity for 2 to 4 weeks after the surgery in order to avoid complications such as bleeding and pain. UroLift is basically a cystoscopy, which is an office-based procedure where we look in the bladder with the addition of a needle that goes through the device and some implants are placed that holds open that channel. And the whole procedure takes about 15 to 20 minutes. It can be done in the office under local anesthetic or with a little sedation. Most patients are back to their normal activity in 2 to 3 weeks, and there's no adverse effect on ejaculatory or sexual function, and very minimal risk of bleeding or need for a catheterization. And lastly is Xiaflex. So Xiaflex is a treatment for Peyronie's disease or penile curvature. As you can imagine, this is a very distressing condition for a man to have. Sometimes it's minimal and doesn't cause functional problems. Other times it can be severely disfiguring and basically render a man impotent or unable to perform. So it can be a major problem. All right. Now, before we had Xiaflex, there's really no good medication. And really, you just had surgery. And surgery involved either placing some sutures on the other side of the penis to try and correct the curvature, or actually cutting out the plaque and putting a graft in. Now, this involved reconstructive surgery. A patient would have to be asleep with general anesthesia. There was a prolonged recovery period. Grafting had a significant risk of permanent erectile dysfunction. And then there's also risk of scarring, shortening of the penile length. When Xiaflex came around, we were all very excited because this was really the first time we had an office-based procedure, a minimally invasive procedure that could help break down the plaque and decrease curvature. And Xiaflex was approved in 2013. And it basically involves 4 cycles of 2 injections done, and it takes about 5 minutes to do in the office, and it's definitely been a major game changer for guys.